How do we make healthcare more affordable in America? Here's a hint. It's not through more subsidies. Corbin Trent came on the podcast to break down the answer for us. Take a listen.
It doesn't matter if you gave everybody universal health care tomorrow. What you would find, because it's a fact, is that there's not enough health care for everybody. There is not enough hospitals, doctors, clinics, eye doctors, dentists. That supply does not exist in the United States of America for 330 million people. The only reason that it seems halfway functional is because there are so many barriers to use. And those barriers are financial, those barriers are geographic, those barriers are social. There's lots of different barriers, right? What I think the Democratic Party needs to be able to comprehend and understand is that normal functionality, normal governance, the way they want to govern, I think that works if you're coasting, if you're gliding. But when you're in an emergency setting, which we are right now in terms of healthcare, in terms of our ability to manufacture the things that we need to survive as a nation, I saw the New York Times wrote 8 op-eds about how we don't have the capacity now to build things that our military needs. But it's not just our military. We can't build these microphones. We can't build this arm. We can't do any of this stuff. We can't build things in this country anymore. We're completely dependent on other people. So we've got to learn how to make things again. We've got to learn how to make doctors faster. We've got to learn how to make nurse practitioners and PAs and nurses. We've got to learn how to get more hospitals and more rural clinics out the door. And I think the only way to do that is to go back to what we had between 1945 and 1965, which is when America was building a bunch of hospitals, and counties and municipalities owned those hospitals. And the people largely that worked in them worked for counties and cities. Now, you might say, well, that sounds like the UK and that sounds like a national healthcare system. It sounds a lot like that. It was a little over 50% nationwide was owned by the states, owned by the cities and municipalities. The place I was born was called Morristown Hamlin Hospital. And it wasn't just like a clever corporate name. That was actually the city and the county that jointly owned the hospital that I was born in.